Life Care Wellness webinar, Medicare 101, all about Medicare and choosing supplemental. Good morning and welcome everyone, and so happy to have you at today's Friends Life Care Wellness webinar, Medicare 101, all about Medicare and choosing supplemental coverage. My name is Gail DiMarcio, and I'm the Friends Life Care Director of Wellness Initiatives, and I'll be your moderator for today's session. So before we get started, I just want to give you some housekeeping information just to make sure that you fully are able to participate in today's event. So here's a screenshot that shows an example of the interface that you should see on the right side. So you're listening in using your computer or tablet speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. There's an orange arrow next to this area of the interface. If you see it up on the block. So you will also have the opportunity to submit questions and comments during the presentation by typing into the questions pane of the attendee interface. So you see the question box with the arrow next to it. So please send any questions and comments at any time during the presentation, and Mariel will be able to respond to some questions during the presentation and will answer some questions at the end of the webinar. So there may be a few times where Mariel will ask you to participate by raising, by raising your hand. So you can do this by clicking on the hand on your screen. So if you see on the screen on the far left side, the bottom right, there's a little yellow hand with a green arrow. So that's how you would raise your hand. So there are also 3 handouts that are available for download on the handout section of your interface. So you should see it place on the box that says handouts. If you click on that and open that, you can download any of the handouts and follow along with the presentation. So now I'd like to introduce our presenter, Mariel Lorenz. She's a CARIE Line Supervisor at the Center for Advocacy for the Rights and Interests of the Elderly. She's going to tell us all about what that is, and she, in her role, she educates older adults and caregivers on health issues like Medicare and Medicaid for the APPRISE program. Mariel, thank you so much for being here with us today. We're really looking forward to your presentation.
Thank you very much, Gail, and thank you to everyone. I'm just going to go ahead and maximize the slideshow here. So thank you everyone for joining the webinar today. As Gail said, my name is Mariel Lorenz. I work for an organization called CARIE. It's the Center for Advocacy for the Rights and Interests of the Elderly, and today we're going to be talking about Medicare. We're going to go over some basics of Medicare, the parts of Medicare, how folks can decide on, what type of coverage they may want, because there are a few choices that folks can do that. We'll also talk about sort of updates for 2018, and if someone needs assistance, where they can get that assistance. So we have a lot of information to get to, and I'm just really glad that I can be here and help present this information. And so I guess one of my first questions is, when we talk about Medicare, I guess how many of you feel that, especially this time of year, it's sort of, you get confused in terms of what your choices are, should you change your plan, what direction you should go to. So I love to kind of see, just sort of for those who can show me, how overwhelming, you could just raise your hand and to let me know there. So, okay. So a few people. It does get a little overwhelming this time of year since we're in open enrollment. You're going to see a lot of television commercials for a variety of different plans, and that unfortunately is that because it is open enrollment, so you're going to have a lot of those health insurance plans and drug plans really coming out there, letting folks know that it is open enrollment and this is the time of year that they can choose their plans. So, but before we get into more about that, I'd like to talk a little bit more about my organization, CARIE. So what is CARIE? CARIE is the Center for Advocacy for the Rights and Interests of the Elderly. This is actually our 40th anniversary for CARIE. I guess the simplest way for me to describe CARIE is that we're an advocacy organization that is there to promote the well-being, the autonomy, and rights of older adults. And even though we're located in Center City, Philadelphia, we have some programs that are sort of more, we have some programs that are particularly for older Philadelphians, but we have programs that that are for across the state of Pennsylvania, like the Senior Medicare Patrol. And the program that I supervise, CARIE Line, is actually a national program that anyone from across the country can access. And what CARIE Line is, it's a free and confidential telephone advocacy counseling program. So an older adult, a caregiver, a friend, a neighbor, whomever, if they have a concern about an older adult, whether it's something wanting to know about the parts of Medicare like we're going to be talking about today, or if it's about how to access PA property tax rebate, or if it's something like help with problem solving. And it could be a number of issues that we help do that with individuals. Maybe it's about how do I caregive for a loved one that's far away from me. We have trained advocates who will talk with those individuals and callers and older adults. And again, it can be, like I said, it could be just providing information, or it can be direct advocacy as well. We've done all of that, and as I said, it's nationwide. So this morning I just heard an advocate talk to someone from South Carolina. So as you know, that just sort of is an indication in terms of if you Googled older adult advocate, CARIE, will come up and can be a resource for folks. So that's our information there. So you can call us. We have a local number, an 800 number, and then I encourage you to look at our website as well to get more information about our organization. And like I said, we do this one-on-one sort of telephone counseling and connecting people with resources and benefits, but we do a lot of advocacy work on a policy and systems level as well. So I definitely encourage you to, please visit our website so you can learn more about us. And but that's just a little bit about who CARIE is. So one of the programs within CARIE Line that I'm trained in is in the APPRISE program. And I guess I wanted to ask for those in the audience, how many of you have heard of the APPRISE program? If I could just see a hand raised there. Okay, so about half have heard of the APPRISE program. That's wonderful. So the APPRISE program, that is what it's called in Pennsylvania. And as the slide indicates, we are a free health insurance counseling program for Medicare beneficiaries. There is an APPRISE program that reaches every county in Pennsylvania. Now, particularly in Philadelphia, as you can see our information here, Philadelphia is densely populated, so there are 3 APPRISE sites. And APPRISE, and I listed those here, that's me, well, I should say not me, there's more than one of me at CARIE. There's also Einstein Premier Years and Mayor's Commission on Aging. We are the 3 APPRISE resources, and what's wonderful about APPRISE, for those that are not familiar with APPRISE, is that we really give the tools for Medicare beneficiaries and their caregivers to try to help make the best choices for their health care coverage. It can get very confusing in terms of what Medicare covers, what type of coverage an individual should have. So our interest is really to use the tools that Medicare gives us to help just present to you sort of what your best options are and empower you to make that decision for yourself. So you're never going to hear an APPRISE counselor say, that a person needs to go with a certain Blue Cross plan or this certain Medigap supplement. We we have no vested interest necessarily in what our vested interest really is, making sure that you're making the decision yourself, you're comfortable with that decision, and that's going to benefit you in the long run. So as I indicated, CARIE is one of 3 APPRISE sites in Philadelphia. And then if you are outside of the Philadelphia area, sorry, just trying to. So if you're outside of Philadelphia in the 5-county metro area, I did list the contact information for Montgomery, Bucks, Chester, and Delaware County, and on the PowerPoint I do have their web addresses. So it is on the handouts that if you needed to contact one of the other APPRISE sites, you can, if you need to schedule individual counseling, then you can certainly contact this these particular counties. If they're just, I always let folks know, if you just have questions that that are universal, I guess, about Medicare, you can call any one of these and they'll be able to answer these questions for you. You don't necessarily have to go within your county, but typically if you had needed more one-on-one assistance, just to let you know that there is, these offices have local staff and volunteers that you can meet individual with. Not everyone is capable of coming to 15th and JFK in Philadelphia where we're located, so I always let folks know that they have this option, that if they're in, let's say, Jenkintown, or if they're in Kennett Square or Plymouth Meeting, they have these options to go to their local APPRISE program. Now, nationally, APPRISE, this program is referred to as State Health Insurance Assistance Program, or SHIP. There's a lot of acronyms in federal programs, and we're just one of them. So if you're in New Jersey or Delaware, or you have loved ones or friends or family neighbors who are in New Jersey and Delaware, this is the contact information that you can reach, again, to get access to the SHIP program. And I did provide that information for you there, so just what is local to those states. Okay, so the topics that we're going to be covering today is, I had already talked a little bit about the APPRISE program, the background. We're going to be talking a little bit about updates that are coming for 2018. I'm not going to talk about Medicare versus Medicaid. Sorry, I didn't delete those slides. We're also going to be talking about sort of original Medicare. I'll mention preventative benefits. What is the Medicare Advantage plans, enrollment periods, eligibility. We'll talk a little bit about where folks can find some savings when it comes to saving on whether it's prescription drugs, or what programs are out there, including PACE and PACENET. And then usually because it is open enrollment and there's so much information coming out, I do like to talk about marketing fraud a little bit, because there's some do's and don'ts when it comes to plan representatives and brokers and what they're allowed and not allowed to do when it comes to trying to market their plans. So these are just some things to consider when, as I said, when you are thinking about healthcare in general, and when you're thinking about a plan, and when you're thinking about your particular coverage. So one of the things that I stress with individuals when we do counseling, if they're thinking about switching either their drug plan, or they're new to Medicare, or they're thinking of maybe they had an Advantage plan. So these are some things that I ask them to think about. So the first one is cost. Think about, what is the premium? What are you going to be paying each month for that plan? Does the plan have a deductible? Does that mean that, is there money that an individual has to pay first before the plan starts covering the cost of the service? If you look at drug plans, a lot of times they may have a deductible, and even some health plans have deductibles too. So those are things to consider. Also, take a look at co-payments. What is, if you have a Medicare Advantage plan, what is the copay for seeing your primary doctor, for seeing a specialist? What if you get an outpatient procedure? What is the copay for an ambulance ride or going to the ER? Those are things to think about. Now, coinsurance is the percentage of the cost of a service. So, for example, in Medicare Part B, which we'll talk about a little bit, typically the coinsurance is 20%. So if Medicare approves the cost of going to the doctor is $100, 80% Medicare is going to pay, and then that $20 left over, that is what the patient's responsibility is. The other thing to consider is coverage. So you have to think about, what are my current medical needs, and potentially what are your projected medical needs? So think about, do I have chronic conditions? Someone who has just high blood pressure is thinking about different things compared to someone who may have insulin-dependent diabetes. An individual who's been in the hospital and then maybe has gone to rehab in a nursing facility the past year may be thinking something differently than someone who has been relatively healthy for most of the year. So that, yes, it's really hard to look in a crystal ball and think about, potentially what could happen to us, health-wise, as the years go on, but these are things to sort of think about. So maybe that's thinking about maybe what chronic conditions may have run in the family. So those are certain things to just think about when you're thinking about choosing your healthcare coverage. The other thing is convenience. So if you're deciding that you want to look at maybe changing a plan or choosing your health coverage, you want to ask yourself, are you able to go to your primary care doctor that you've been going to? Is there certain specialists that you frequently go to, and would you still be able to go to that individual if you change your health plan? What about your hospital? Is that covered in the particular health plan that you choose? Or about a pharmacy? Sometimes certain pharmacies, depending on the drug plan, they may have what's called a preferred pharmacy. So they may have certain chains or stores that they prefer their members to go to. Doesn't mean you can't go to your pharmacy, but you may be paying more for particular medications. So again, these are sort of things that when you're meeting with an APPRISE counselor especially, or if you're thinking about changing your coverage, these are things to think about, and you want to check, because you don't want to find yourself choosing a plan for next year and then you find out you can't go to your pulmonologist or your endocrinologist doesn't take that plan. So these are certainly things to consider. This thing, the consumer satisfaction, Medicare a few years ago started a 5-star rating system, and it's a number of different factors that contributes to the star system. If you go, and I'll show you a little later on Medicare's website on how folks can choose, when they are comparing plans, where do they fall in the star rating. So Medicare really likes for plans to have 3 or more stars. And I'm talking more exclusively about Medicare Advantage plans and drug plans. So just to let you know about that. So because again, that may be a factor in your decision, because again, one of the things that goes into the rating system is how friendly is their customer service, are they easy to get a hold of, things of that nature. Do they have a decent sized network of providers? So again, things to think about, and you definitely want to look for, if you're deciding on changing a plan, or you're thinking about, if you're new to Medicare, you definitely would like to look for something that's a 3 stars and over. So I I kind of brushed on this, you know, I talked a little bit about this. So this is just some Medicare vocabulary that we hear. We hear deductibles and premiums and coinsurance kind of just thrown out there as acronyms are thrown out there. So this is just sort of a guide for you. And as I said, I explained in the previous couple previous slides, just a brief introduction to what these terms are. But these are things to keep in mind when it comes to choosing your healthcare coverage. So I'm briefly going to talk about what's coming up for 2018 before I talk, you know, before we go further. So how many of you have heard, and you can raise your hands to let me know, how many of you have heard that there are new Medicare cards coming in 2018? Oh, only a few. Okay, well, just want to, I'm putting out the word, okay? And we have a handout that it addresses this. So just to give you some background, a couple of years ago, there was a law signed that CMS, this is the Centers for Medicare and Medicaid who manage Medicare, they are going to provide new Medicare cards to all 54 million Medicare beneficiaries out there. And the reason that they're doing that is they want to help to curb Medicare fraud. One of the issues, if you look at your own Medicare card, is that your Medicare number is either your Social Security number or your spouse's Social Security number for most people. And that, as you know, that could be a big security risk for some folks. So what is happening is that starting in 2018, these new Medicare cards, April of 2018, new Medicare cards are going to be mailed out. It will be mailed out to groups of people at a time, and you will be assigned a new, you're not getting a new Social Security number, like that stays the same, but basically for Medicare, you're sort of getting your own new identifying medical number for your Medicare card. So just to let you know, the benefits are not changing. You don't have to do, the only thing you would have to want to make sure is that if you recently moved, you want to make sure that that Social Security has your correct address, because Social Security is going to be sending these cards out to you. So you really want to make sure that you know, that they have the correct up-to-date information, so you will get that card. You're not going to have to be responsible for paying for a new card or anything in that nature. So just to let you know about that. This is what our current Medicare card looks like. As I said, you know, right now a person has their Social Security number on their card or their spouse's Social Security number. So again, to curb fraud, what is happening is that the new card is going to look like this. It will still be red, white, and blue. It will still have the dates that when your Part A and Part B coverage had started. The only change is that now you will be assigned a unique identifying Medicare number. So it's going to be a mix of numbers and letters. That is the only change. Again, this has been sort of kind of years in the making. There's been a lot of advocacy for many years to get this to change, and now we're here. So one of the handout that we have on this issue is, you know, anytime that there's like a new initiative coming out, there can be a cause of concern for scams or fraud. So just to let everyone know that Medicare should not be calling you to confirm your address for your new Medicare card. So I'm going to just let you know about that. And the handout has some information, again, to help protect yourself from fraud. So there's some information there. Now, in terms of other new things for what's coming up in 2018, unfortunately, there's not a lot of updated information yet. So when we talk about the sort of the parts of Medicare, I'm going to be going over certain things like deductibles and premiums for original Medicare, and typically, usually around this time, we get a sense from the government what those changes are going to be. But we've only just learned a few weeks ago that there was a 2% cost of living increase for Social Security. So that means that for those who are Social Security beneficiaries, they're going to see a 2% increase in their monthly income for 2018. So usually after that, when we get that announcement, that's when we start hearing about if there's going to be any changes to original Medicare's deductibles and premiums. So I'm hoping to hear that soon. And of course, once I hear that, I'm happy to, you know, send some updated information to Gail so she can just, you know, let all of you know that. So I thought we could go through the parts of Medicare, and I'll make sure that I'll stop, and so if folks have questions, we can make sure to address that. But just to kind of go over, these are the parts of original Medicare. When we think of Part A, that is your hospital coverage. Part B is your doctor coverage. When you hear Part C, it was interesting. A person the other day had asked me, "What is Part C? I don't know what that is." Well, those are your Medicare Advantage plans. Those are those private plans like your Keystone 65 or your Aetna or Humana. Those are private insurance companies who've agreed to basically provide the coverage that original Medicare does and maybe some extra things too. And Part D is for drugs. So those are those prescription plans. So these are the sort of the ABCs of when it comes to the parts of Medicare. Now, when someone is new to Medicare, there's a few different choices that they have when they decide that how they're going to build their Medicare coverage, and we'll go over those. So when it comes to building your Medicare coverage, those building blocks, there's three options for individuals, and we'll kind of go into each one a little bit. So option one is just having that original Medicare, your red, white, and blue card, and a prescription drug coverage. So that's one way of doing it. The second way of doing that, option two, is some folks, they have that red, white, and blue for their Part A and Part B, and they have a drug plan, and then they also get what's called a Medicare supplement plan or Medigap. They're interchangeable. Those plans are, I'll talk about those a little bit, but those are your like AARP, United Health, Bankers Life. There's a number of different plans, and basically they are used to help reduce or limit sort of those out-of-pocket costs, because, you know, remember, Medicare A and B, they don't cover everything. They don't cover all the costs that, you know, that medical needs may have. So some folks decide that they get a supplement. And then option three is those Medicare Advantage with a prescription drug plan. So they get a private plan like Keystone 65 or Personal Choice or Aetna, and it covers the hospital, covers hospital, it covers the, you know, that kind of Part B, the outpatient things, your drug coverage, and it may have some extra things too, which we'll talk about, maybe a wellness program, or sometimes some plans, you know, maybe some vision and dental as well. So it really depends on the plan. And like I said, there's even kind of options of coverage within option three. So we'll talk about all of those. So that's just kind of a summary of what your options are, and we're going to kind of get into option one, option two, and option three individually. So starting with option one, this is sort of if someone just had decided, I'm just going to have my red, white, and blue card, and I'm going to have a prescription drug plan. So when we're talking about Part A, this is hospital coverage. So this is, for example, this is if you were admitted into the hospital and then had needed maybe skilled nursing facility care after that, after that hospital stay. This also covers hospice services. It can also, if connected with the hospitalization, if there's home health services in your home that you would need. So again, Part A are, I just think of hospital services related to the hospital. That's typically covered under Part A. Now, typically, if you had been working for 10 years, there's no premium for Part A. That is what those Medicare taxes go towards, is those, to that cost. But Part A does have a deductible, and again, this is from 2017. We don't have 2018 figures yet, but the deductible for Part A is $1,316. And that means that if you were in the hospital for either, admitted for one night or admitted for, 10 nights, you're going to be responsible for $1,316, and that's in a benefit period. And then I have a little bit of an explanation there of what a benefit period is, but basically that is a person's responsibility. And the hospital bill could have been $10,000 to $20,000. You're going to be responsible for that $1,316. So as I see, so again, this is if you are for some hospital coverage. So for example, if you were in the hospital and from days 1 through 60, you have that $1,316. If days from 61 to 90, now there's a $329 copayment, and after that per day is $658. So unfortunately there are some folks who have they could potentially have long-term hospitalizations, and these are some of the costs if they just had that red, white, and blue card and a prescription card. So again, this is just to emphasize, this is just if you have your red, white, and blue card and a prescription drug plan. So there are some instances where someone has a hospitalization and then either it's recommended that to continue their recovery to go to a skilled nursing facility or receive home health services at home. So again, this is covered under Part A. And just as a reminder for individuals that to be eligible for that type of coverage, a person has to be admitted for 3 full days to be considered. And the other thing is you cannot be under observational status. I could probably do a whole other webinar about observation versus admittance into, inpatient as a hospital. And I'm just noticing my misspelling there, right? Should be inpatient, not inpatient. So anyway, sorry about that. And just again, this is something that usually the doctor would recommend after the hospital stay. And again, this could also include home health service at home. Folks do have that option, and it's a very personal choice, and certainly you would want to discuss that, if in the event and time. So just to kind of go over some costs here, and again, it is in the handout, so if you need to refer to it later, it is there for you. So just to let you know that if in the event that a skilled nursing facility or SNF is recommended, if you just have that red, white, and blue card, you're not going to have a copay for the first 20 days being in that SNF. But then from days 21 through 100, when you're getting those skilled services in the SNF, the copay could be $164.50. And just to let you know, a person has 100 days in a benefit period. So that's pretty hard limit, and so there's really, unless you, and we'll talk about it later, a person decides to get additional coverage, they may just only have that 100 days for skilled nursing facility in that benefit period. Does anyone have any questions in the chat about Part A or things that I've talked about beforehand before I start talking about Part B and medical coverage?
I don't see any questions.
Okay, all right, okay. And feel free to, yeah, and feel free to, like I said, please chat in your questions. I'm happy to try to address them, and or even just let me know that, can you explain that again? I'm happy to, I would be happy to do that. So moving on, again, if we're just talking about if you have your red, white, and blue card and a drug plan, part of Part B is your medical coverage. So I think of anything outpatient. So going to see your primary doctor, a specialist, outpatient physical therapy, outpatient occupational therapy, durable medical equipment, so wheelchairs, hospital beds, things, just a number of different types of equipment, oxygen, certain medications, and preventative benefits. So that is the services that encompass Part B. Okay, so again, I don't have 2018 pricing yet. I'm sorry, they didn't come out with that. So I'm just going to share with you for 2017. And there's some caveats with this too. So if you were new to Medicare in 2017, your monthly premium is $134. Now I do know that there are beneficiaries who are, maybe they were eligible for Medicare, 5 years ago, 3 years ago. They are not paying this premium. This is, as of right now, that if you were new to Medicare in 2017, this is what your monthly premium would be. And this comes out usually of your Social Security income, or for those who have not started collecting Social Security, but they're on Medicare, they pay that directly to Medicare. There is an annual deductible each year. For 2017, it was $183, meaning that before Part B started paying for that those services, then you have to pay $183 first. And usually on your Medicare summary notice, that for those who just have original Medicare, it will tell you if you met your Part B deductible. So that is, again, this is what it is for 2017. For 2018, we don't know what the deductible is going to be. Hoping to hear about that in the next couple weeks. When it comes to coinsurance, basically there is a 20% coinsurance. So, again, that could, for some, maybe that's, if Medicare approves $100 to go see your primary care doctor for a visit, so your copay is going to be, that is $20. But if there's if there's a wheelchair that someone may need, or there is lab or outpatient procedure that it needs to be done, those can be much more expensive. So that, even though 20% percentage-wise is a small amount, depending on the overall cost of the procedure or of the equipment, that could be very expensive for individuals. So again, this is for those who just have that red, white, and blue card and their prescription drug coverage. So I just want to kind of go over, now this is sort of universal. If no matter sort of what type of coverage you decide to go with. Medicare, a few years ago, was part of the Affordable Care Act. They really wanted to encourage people to get these preventative screenings. Now, some of them may have costs associated with it, and some of them don't. It just depends on your, maybe if you have a history of a certain chronic illness, but they're either low cost or there's no copay at all. This includes, which I don't have listed here, is your annual wellness visit. So once a year, an individual a Medicare beneficiary can go to their doctor and get an annual wellness visit, and there's no copay associated with that. For those, this could be, the list is here with mammograms, various cancer screenings, the flu shot, so that's happening right now. So I definitely encourage you to, get your flu shot if you can. It's usually recommended for Medicare beneficiaries. Again, depending if you're a smoker and you need help quitting, there's preventive benefits available for that. So this is just sort of a snapshot of what those benefits are. So, and if you have questions about those, you can feel free to ask APPRISE individuals or call Medicare, and they can give you more information on that. But that's just, again, to, one of the things that is encouraged is to make sure that folks are trying to prevent those illnesses if they can. So moving on to having that drug coverage. So as you know, Part D, it's actually more than 10 years old now that Part D had started, and things, these are, you have Part D premiums. They can vary from plan to plan. Some of them have deductibles, some of them don't have deductibles. Some of them have, like I said, the pharmacy copay can vary from one plan to another. Just to let you know, these are private, these are private plans that provide the drug coverage. There's no, like Medicare, the government itself does not have, doesn't really have a drug plan, or at least through, Medicare itself doesn't. So this is, these are all through these private plans. Just to let you know, for those that are, maybe it was recommended that they get or they've seen on television about the shingles vaccine. So this is, as I noted earlier, like the flu vaccine is covered under Part B, but something like the shingles, that vaccine is covered under Medicare Part D. So if you're thinking about the shingles vaccine, again, I would definitely look at your drug plan, look to see what the copay is, make sure it covers it. So because that can really vary with each plan. So again, just to let you know that this is an instance where this particular vaccine is covered under Part D. So I'm just gonna I don't know, how many of you have heard of the donut hole? If you can raise your hand, you can let me know. Okay, can everyone see this graph that Gail, I don't know if you can see it with the Medicare Part D prescription drug benefit.
Yes, we see it.
Oh, great. Okay. So this is this is just a little illustration about the donut hole. So for those of you, this is sort of how, when it comes to drug coverage and the drug benefit, how it works. So basically you have in 2018, the maximum deductible that a plan can charge is $405. That means that that's the money that a person may pay out first before the plan starts covering it. Also, we're going to have, so then after that, you may pay, you have a copay, your plan pays a portion for the medications. If you reach $3,750, you can potentially end up in the donut hole. Now for 2018, remember, just a reminder that when the Affordable Care Act came out, one of the initiatives was to reduce the donut hole, or that coverage gap. So for 2018, a person's going to be paying 35% of the cost of a brand name drug and 44% of the generic while they're in the donut hole. Once they reach now $7,508, now they're going to begin catastrophic coverage, where they're only paying between $3 and $8 for medication. So I did include that handout, but just to let you know what the updated sort of limits for the donut hole will be for 2018. By 2020, the donut hole will be closed. So so just to, I know it's a couple years away, but just to let you know. And again, you may really want to consider when you're looking at, if you're thinking about changing your drug plan, you really want to find out, is it possible that you could reach the donut hole at some point? If you have a fairly expensive medication, that that could happen. So you definitely want to take a look at that. Does anyone have any questions about Part A, Part B, or Part D? I don't think I see any questions in the chat.
I don't see any questions.
Okay, so I'm just now going to go with option 2. So some folks, they have their red, white, and blue card, they have their prescription card, and now, like I said, they want something a little more because, there are costs with original Medicare. So some folks may decide that I'm going to get either a Medicare supplement or a gap plan. These are some of the, one of the reasons why folks may consider that. There's typically no referrals. If you travel a lot, like I know some individuals, they're in this area for part of the year, then they go to another state for part of the year. They want a lot of flexibility, so they decide to get a Medigap plan. Now, just to let you know, with Medigaps, there are 10 standard plans labeled A through N. There are some plans that have retired. That's why it's not a perfect alphabetical order here. Typically, there are, what's nice, so if you go to, like I said, Bankers Life, or if you go to with a plan, let's say Plan C, or if you go to United Health AARP Plan C, it's going to offer all the same things. There may be different costs with that, but it will offer but these are 10 standard plans, and just to kind of give you some information. And some folks, again, they like that because there's a lot of flexibility with having a Medigap supplement. Some of the cons, I guess, is that it can be very expensive, especially with premiums, and sometimes depending on when you decide that you want to get a Medicare supplement, you may be, depending, if you didn't get it within that first 6 months that you're eligible for Medicare, you could be subjected to medical underwriting, so that may provide additional costs as well. So now we're going to be talking about Medicare Advantage plans. In Pennsylvania, about 33%, I think it's almost between 33 and 35% of Medicare beneficiaries have a Medicare Advantage plan, which is actually, when you look across the nation, that's on the high side. And so, there's many Pennsylvanians who decide that they're going to do a Medicare Advantage plan. And that's also known as Part C. As I explained before, these are private insurance companies that offer these plans. An individual has to have Medicare A and B to be able to get this type of plan. A lot of times that Medicare Advantage plan may have a drug plan attached to it. Sometimes they don't. But again, most of the time, especially new enrollees, if they're just choosing to do a Medicare Advantage plan, the drug coverage is it is included. And usually, and how it works is that Medicare they sort of just really pay a certain amount of money each month to these plans to offer the things that they would have gotten if they just had gone with Medicare. So some of the costs that you're going to see with a Medicare Advantage plan. Now, even though you have a Medicare Advantage plan, and you have to have a Part B, you're still going to be responsible for that Part B premium. So if for someone who's new to Medicare in 2017, they decide to go with a Medicare Advantage plan, they're still going to have that $134 premium plus the costs associated with that Medicare Advantage plan. And these are some of the costs or coinsurance that would be included. So again, things we talked about, premiums, deductibles, could be for the medical part or the drug part, copays, etc. Again, some reasons why folks decide to choose an Advantage plan, because there may be some extras. That could be hearing, vision, dental, sometimes medical transportation. Depends on the plan, or if you like silver sneakers or a wellness plan, some folks decide to do a Medicare Advantage plan. So just to share with you very quickly, there are 3 different types of Medicare Advantage plans. You have your health maintenance organization, known as HMOs, preferred provider organization, or PPOs, and special needs plans, which are known as an SNP plan. So your HMO, similar to if, when folks were working and they had employer-based plans, or if they were on the individual market. With an HMO, you have a network of providers. You typically need a referral. You typically needed to say who your primary care doctor is. If you went out of that network, the plan is not going to pay for that service unless it's like an emergency. There's some certain circumstances, but typically they're not going to pay for that. Again, you really want to make sure, as we talked about before, are your providers in their network? That's very important when you're choosing, if you decide to go with an HMO. Also, if you want the prescription coverage, it's through that Advantage plan. So again, most of the time they're going to have a drug coverage associated with the Advantage plan. PPOs, again, there's still a network of providers. You may have the option to go out of the network. It will tell you in the summary of benefits what what those costs would be. You may not need to do referrals. Again, as I said, I'll keep saying, make sure that your providers are in the plan if you're deciding to shop around. Special needs plans are for maybe individuals who they have very low income and now they qualify for medical assistance, or they may be in a nursing home or they live in their home and they're getting services that there's a program that the state may pay for. There's some certain services that folks qualify for medical assistance, but typically special needs plans recognize both Medicare and medical assistance. Sometimes some companies offer, like a couple years ago, Cigna used to offer a special needs plan for those who had type 2 diabetes. So they could enroll into a special needs plan. And again, there's a network of providers, there's typically referrals similar to the health maintenance organization, but it's more or less to help coordinate with Medicare and Medicaid. Does anyone have any questions so far about, I went quickly through Medigap's and Medicare Advantage plan. Does anyone have any questions on that?
Do you have any idea what the range of the monthly cost for the Advantage plan? You may not.
So it depends. So some plans you can see a 0 to 0 premium. And then there's, so just for the premium, it could be $0, and then some you could see over $200. Typically for the zero premium dollar plans, they're typically either special needs plans or HMOs, and the more expensive premiums for those type of Advantage plans would be the preferred provider organization plans. I used to, a few years ago, it used to be that if you had an HMO, maybe you had a lower premium, but your copays were higher. And if you had a PPO, you had somewhat lower copays, but lower, excuse me, a higher premium, but somewhat lower copays. And now I'm seeing that's not quite as true as it used to be. It really depends, and that's where, and I can show folks in a few minutes the plan finder at Medicare, so you can get a sense of what the costs are instead of you having to call each plan. If you're computer savvy, you can use the plan finder. So I'm just going to go over really quickly. If you are new to Medicare, when folks are able to enroll, they remember, if they've been working for most of their life, then the only thing they have to do is call Social Security and let them know they're ready to enroll in Part B. So most folks, when they have 3 months before they're 65, that 65th birthday month, and 3 months after they're 65 to enroll into Part B and start thinking about, what type of coverage that they're going to get. As I said, if you need to enroll in Medicare A or B, like I said, most folks don't even have to call to enroll in Part A. You're automatically enrolled if you've been working for 10 years. But you have to call Social Security. Don't call Medicare. So you would be calling Social Security for that. If you, again, just another plug for APPRISE, what we do if you want to enroll in Part D, a supplement, or an Advantage plan, you can call us, and we'd be able to help educate you on those types of coverage choices. I'm just gonna skip here. So this is the annual open enrollment period right now. We're in it. So it's from October 15th through December 7th. So if you're deciding to change your plan, that starts on, if you decide to change, your new coverage is going to start on January 1st. And again, I can show you, this is the plan finder. Let me just maximize that. So you can go to medicare.gov. You can either just do a general search where you put in your zip code and you can find your plans, or you can do a very personalized search. You're putting it, now, just to let you know, this is a secure site. So I know some folks are weary about putting in, private information, but it is a secure site, and this is the tool that we use in helping folks to compare plans. So and in fact, this is a video on how to use the plan search. When you put in your zip code, it's going to ask you, well, what coverage do you have now? Do you have any benefit programs? And it will talk about, it will talk about, what options are available to you. And this is a really great tool just to, again, to help with deciding your coverage for next year. I do have some including here when it comes to maybe saving on prescriptions, the Extra Help program, PACE and PACENET, which is exclusive to Pennsylvania. Those are, again, that's been a program long time in the state, even before Part D came out. This also helps with cost of prescriptions as well, and there's some, and I have here what the eligibility for that income is, so that's for you there. If you are interested in hearing more about these programs, feel free to give us a call. We'll be happy to talk to you about that. And then, like I said, in the end, I did include some information. I want you to, if you want to take a look at just when it comes to managed care marketing fraud, as I said, there's some do's and don'ts when it comes to what plans and brokers are allowed to do. So basically, to summarize, when it comes to marketing fraud, you have to give permission to brokers to call you, to email you, to come to your house to visit you. The mail is a little more tricky. I mean, you're good. Unfortunately, when my dad just turned 65 in July, and it's just getting a ton of mail, right? He was just getting a ton of mail from different plans. He's still working, so he's not, thinking about Medicare right now. But really, to summarize, when it comes to legitimate contact and prohibited contact, is basically, if you got a knock on your door from somebody who's the broker or a plan representative and you never gave permission for that person or agency to come see you, then that's marketing fraud. You can call us. We report that to Centers for Medicare and Medicaid. So that's just some other things to again, to look over, because this time of year you're going to get advertisements for marketing for different events to attend, or you may get phone calls. And just to let you know that there are some do's and don'ts when it comes to plan representatives and brokers.
Well, Mariel, thank you so much for this very, very informative discussion today. You gave us a lot to think about. I know it's 12 o'clock and it's time to end. And I want to thank you so much for being here. I do have just a few questions, so if anyone would like to stay on the line as you answer the questions, they're more than welcome to. But the webinar is officially over, and as you exit the webinar, you'll get a survey with just 3 questions on it, just 3 multiple choice questions, just so you can just give us your feedback, so we will know for future webinars. But thank you for joining us, and if you can stay on the line for the questions, please do.
Yes. Yeah. Great.
So the first question is, if you enroll in an Advantage plan, can you later transfer to a Medigap plan without penalty?
So so it depends. If someone enrolls into an Advantage plan, and within the first year of having that Advantage plan that they decide they want to go enroll into a Medigap supplement, then they will not be subjected to what's called they'll have what's called guaranteed, I believe it's guaranteed right coverage. So basically, they're not going to be subjected to medical underwriting or potentially not being eligible for that plan. But if someone has had an Advantage plan for more than a year, they've had it for multiple years, then if they decide to go to a supplement, they again could be facing they will face medical underwriting. So they may have a higher premium for that Medigap, or they could potentially, depending on their conditions, they may not be eligible for that. So it depends on the plan.
Okay, well, thank you very much. And somebody else had asked the same question. I think that's all the questions we have, because we have a couple questions that were the very same. But thank you. Does anybody else have any more questions before we close? And if you'd like to contact Mariel, she has her information, and she is, as you can tell, an invaluable resource for this. And if you feel free to reach out to her and contact her. And Mariel, thank you so much for being with us today. We really, really appreciate it. You've really given us quite an education in a short period of time. Thank you.
Oh, no, thank you. I know it was a lot, and I just hope that this will be helpful for you in making your decisions for next year. Or if you're happy with your coverage, you don't have to do anything. So if you're happy with what you have and you got your notice for what's coming up next year and you're okay with that, then you're set.
That sounds great. Thank you so much. We appreciate it. I'm sure you'll be hearing from several of us.
Okay, great. Well, thank you. Thank you, everyone.
All right, take care. All right, bye-bye.
Bye-bye.